Um, you've touched on this a little bit, but what are some of the barriers to medical care that you've seen in your work, and specifically in Tanzania?
Yeah, infrastructure is a huge piece of it.
Yep.
The roads are, often unpaved, they're crowded, there's a lack of, traffic lights from, and, speeding, motorcycles, and just a young population as well. So, funding and resources is another issue that can be, a barrier. So, one of the things that we're working on right now is not just providing education, but, starting conversations and essentially doing, advocacy work, for lack of a better word, to try to get more buy-in from, the local police leadership to, give them the supplies that they need in order to leverage some of the skills that we're teaching them how to use. So,
yeah. And then how did mental health care become part of this program, and what areas do you see that are in great need in terms of
yeah, that's a really good question. So, we went down there the first time, and the first time we provided some education, it was more just generally speaking about what pre-hospital emergency medicine looks like in the West, right? We came back, we talked about what went well, what could be improved, and one of the conversations, or one of the things that came up, was mental health. Here in the United States, it's under-addressed for sure. And so, we sort of had this idea in our head that if we were going to create a training program, that we should do it in a best practice sort of way, and that would be to include some education on, post-traumatic stress disorder, and do it in a culturally competent way, right? So, not just walking over there and assuming that Western mental health care is going to be the best for people we're training, but just starting to have a conversation. So using, World Health Organization guidelines, partnering with a local psychologist, and developing a mental health curriculum that really just sort of puts context around the experience. And what we learned the first time that we rolled that program out was that the divide really isn't that great. They're asking questions of us, along the lines of, why am I drinking so much? Why am I having difficulty with my wife? Why can't I sleep for a week after I see, somebody who's died on scene? And, one of the biggest things that we came across anecdotally is this idea that their colleagues aren't responding to some of these calls just due to the, mental and emotional trauma that they're experiencing, which is significant because that's a barrier to care, right? And so we can give them training and material all day long, but if, the psychological impact is preventing them from going in the first place, then what's the point? So you really have to address, I believe, both of those things in concert, right? Giving them the skills that they need and providing them with emotional and mental strength and resiliency in order to meet the demands of that job.